Weight management is a challenge for millions of people.
Small changes, though, can make that process a lot easier. Newswatch 16's Justin Gick finds out how in this Healthwatch 16 report.
Healthwatch 16 is sponsored by UPMC, life-changing medicine.
The U.S. Department of Health and Human Services says about 2 in 5 adults and 1 in 5 children and adolescents in the United States have obesity, and many others are overweight. Dr. Marcus Powers with UPMC Primary Care in Lock Haven helps patients struggling with weight management. Dr. Powers says weight management can improve certain medical conditions such as high blood pressure and high cholesterol.
It can decrease the rate of heart disease. It can improve diabetes, fatty liver disease, different musculoskeletal conditions such as joint pain, any back pain. It can help with mental health like depression and anxiety.
Dr. Powers says nutrition and physical activity are definitely foundational components of weight management. However, he says doctors do look at some other factors, recommending good quality sleep, as sleep deprivation can increase hunger hormones. Dr. Powers says he also recommends stress management, as stress can also lead to certain emotional eating patterns and just stress overall.
We also want to address just mental health and to better control underlying depression or anxiety. And it's also important to look at one's medical conditions, as that can lead to weight gain, and even looking at medication side effects that can also lead to weight gain.
Dr. Powers says it's important to start with small lifestyle changes when it comes to weight management. He says he usually recommends that his patients keep track of what they eat and drink by keeping a food journal. He says that way they can always look back to see what changes they can make with substituting more healthier eating options with snacks, more fruits, and vegetables.
It's also important to keep track of just the daily number of steps you take per day. We do recommend 30 minutes of moderate to strenuous exercise per day, 5 days per week. So start with small changes and try to add more over time as you're able to do so.
Dr. Powers says he tells his patients to always discuss their goals with close family and friends. He says they can help encourage the patient, keep them accountable, and may even want to join with healthier lifestyle decisions. Dr. Powers says that can make the goals more realistic as well. He says to start out small, for example, what can I change now, and take it one day at a time. Dr. Powers says don't just look at a number on the scale, but look at some changes you can make over time to obtain that goal. He says the first step is to sit down with your primary care physician and have a discussion.
The PCP can kind of lay everything out in front of you regarding what are recommendations, what are changes you can make. They can even connect you with the nutritionist. They can connect you with a behavioral counselor.
For this Healthwatch 16 report, I'm Justin Gick, Newswatch 16.